Myself, Dr. Sailesh, I'm a cancer surgeon, uh, running my private Surgicare hospital in Anand town, district Anand, Gujarat state. Since 1998, we are running this hospital. We have 20-bedded hospital, and we are treating all the varieties of the solid cancer. The most of the 90% of the cases that we face in our district is of head and neck cancer, and because of the tobacco chewing and alcohol consumptions, day by day we are getting more number of the patients of the head and neck cancer. We treat all the varieties of the head and neck cancer, which includes the tongue cancer, buccal mucosa cancer, lip cancer, gingival cancer, palatal cancer, and all types of the cancer. And the most important thing is we have a team of the plastic surgery in our hospital for the reconstruction of the patient, to give the patient more satisfactory cosmetic appearance after the removal of the part of the face. Second number, we have a number of the patients for the breast cancers, and more some younger patients we are treating in our patients with breast conservation. That means without removing the breast, we treat the patients of the breast cancer. We have all the infrastructures and the support for treating the patients for chemotherapy. So no need to go to patients outside for the chemotherapy. And we have a very good setup for the chemotherapy. We have a very nice storage department for the chemo drugs, because knowing you people are must be aware that all the chemotherapy drugs should be kept in a fixed temperature, rather than putting the chemotherapy drugs in a domestic fridge. So we have a isolation, this dedicated unit for the chemotherapy drugs, and we have trained staff. We have very qualified staff for the treating the patients for the post-operatively, as well as for the chemotherapy. And we used to handle the internal jugular venous spot very nicely. So more than 500 to 550 numbers of the patients we have put the venous spots since last 10 years. More than 500 pots we have put, and we usually treat the patients for the chemotherapy by this venous pot. And we have got the very good post-operative intensive care unit for taking care of the patients after the surgery. And all our rooms, they are equipped with the central oxygens and central monitoring, and full time we have got the very nice department, very good department for the pain relief of the terminal stage of the cancer patients. And we have got all the narcotics drugs in our hospital. We have an official license for keeping these narcotic drugs in the hospital. So our hospital is very well equipped with all the gadgets which requires to treat the cancer patients. We have got the ambulance facility in our hospital, so any patient can be transferred without any hassles to anywhere if needed. And our hospital usually, our consulting time usually start in the 9 in the morning, and up to the 2 in the afternoon, and then again start 5 in the evening, and ended in the 7 p.m. in the evening. And any emergency, we have all the facilities to call to our doctors, and we displays all the this contact number on our website. You can visit our website www.drsaileshshah.com for further information about our cancer hospital. And if any query or if anything required, you can call me on a number 98250 94525. Thanks.